If we are going to start an IVF, in vitro fertilization, there are some terms referred to PGD, PGS. So both are types of pre-implantation genetic testing, PGT, that are important treatment options for patients that undergoing IVF treatments. So first, the PGS, the pre-implantation genetic screening, and PGD is the pre-implantation genetic diagnosis. So are both performed on cells from embryos in the embryology lab, but they have different purposes and screen for different genetic problems. The PGS screens cells that have been biopsied from the embryos for potential genetic abnormalities when they are no potentially inherited disorders. PGD, on the other hand, uses the same process to detect a specific disorder that has a high probability of being passed down from parents to their offspring. So although many people having fertility treatment will not need to have these types of testing done, PGD or PGS may assist your reproductive physician in finding healthy embryos to implant in your uterus during the process. So although PGS, that is a screening, does not test for a specific disease, the procedure does screen for chromosomal abnormalities such as Down syndrome. It also identifies chromosomal aneuploidies in the embryo, even if there's no evidence of a genetic abnormality in parents. So PGD, that is diagnosis, it's not a screening, involves genetic testing of an embryo for a specific gene mutation when one or both parents are aware of the existence of the genetic abnormality. This test is important if you have a story of genetic disease in your family and you want to be sure that you are not passing it on to your child. So in some cases, you may be a carrier for a disease without having the disease yourself. So PGT tests could be done, for example, in translocation of genes, that is loss of chromosome, is an exchange of chromosome materials or other structural rearrangements that can cause some birth defects. PGD can be done in Huntington's disease, Marfan syndrome, recessive genetic diseases, genetic diseases on the X chromosomes. So PGT is more complex process than PGS, that is just a screening because it examines for individual genes. So it is recommended first for couples that have a genetic predisposition or if they have any chance of passing down one known genetic abnormality. So any couple with a family history should be also diagnosed and then screened. So families that, for example, have a history of severe gene defects, such as, for example, muscular dystrophy, should also consider PGD testing. That is important, but if any couple with a family history of miscarriage or Down syndrome, they should only pass through a screening, a PGD test. But if they have a diagnosed gene, a faulty gene, they would go for a further process that is called PGD testing to diagnose a specific gene, for example.